Today our guest is Dr. Dye. Dr. Dye is a highly respected, fellowship-trained oculoplastic surgeon at Fraser Eye.
Respected. Wow.
Right?
Thank
Of course.
you.
Her expertise spans eyelid surgery, orbital disease, tear duct disorders, and advanced facial rejuvenation techniques. Welcome, Dr. Dye.
Yes, sir. Thank you. Thank you for having me.
So when you're in medical school, there's a lot of options. What inspired you to become an ophthalmologist?
Well, I didn't really know what I wanted to do during medical school. I was considering a lot of different options. I think initially I wanted to go into neurology because I majored in neuroscience during college. And I was always interested in that brain to body connection. But my medical school's dean is a ocular pathologist. So he was trained in ophthalmology. So he mandated a 2-week rotation in ophthalmology for all students. And before then, I didn't even know what ophthalmology was, but when I rotated through, I really enjoyed it. First, because I was interested in a surgical subspecialty. I really liked working with my hands. And then the surgery itself, it's microsurgery, so very controlled, a short amount of time, and interesting surgery. And you also get the interesting science behind ophthalmology. You can look at the optic nerve, you see all these beautiful pictures of the retina, etc. So everything kind of fell into place after that.
Then at what point did you pivot and say, like, I don't want to do cataract surgery or glaucoma surgery, specialize in the retina. I want to do oculoplastics. When did that come about?
It's kind of a repeat of the same story where I was considering multiple subspecialties. I think in the beginning I was considering retina because I did some research within retina during medical school. I tried a lot of different rotations, and it just happened that the first rotation during my second year was oculoplastics. And I really tried to not love it because I knew it was a very competitive subspecialty. But the more I did it, the more I loved it. And in the end, I decided to pursue it. And then to answer the question about cataract surgery, I think I reached my 100th cataract. And at that point, I just really didn't enjoy the surgery itself. I found it very repetitive, very high stress being in the eye. Whereas with oculoplastic surgery, there's a lot of different varieties. I could do a bleph. I could do an ectropion repair. So there was a lot more variety in that, and I enjoyed that aspect.
So just like you mentioned about doing a bleph or an ectropion repair, truly being an oculoplastic specialist, what conditions do you really treat?
People always ask, oh, so you're a plastic surgeon. And I would say it's a little different. We're trained in ophthalmology, and then we do extra fellowship training within the realm of oculoplastics. So when people ask me what do, I say, oh, plastic surgery around the eye. And people, nowadays, everyone's getting a blepharoplasty. So they're like, okay, you do blephs. And yes, I do. I do enjoy the cosmetic aspect of my practice, but a lot of my job satisfaction, if you will, comes from also treating the medical and functional aspects of the eyelid. If you remember seeing a pug, sometimes their eyelids are like this. And in medical terms, that's ectropion. And when the eyelids hang down like this, it's not really protecting your eyeball all that well. So a surgery that I perform is essentially putting the eyelid back to the place that it belongs so that it can help protect the eye. So with oculoplastics, it's both form and function as well as aesthetics. We're trying to put the eyelid and the structures around the eye back to its original position and function while making it look good as well.
And the big question is, like, where does the eye end and, like, the cheek begin?
Honestly, I don't know.
Yeah, and that's where with blepharoplasties, it's just not eyelid. There's sometimes brow or forehead, so you are actually doing surgery within the forehead. And I'm sure you do, like, skin cancers, I'm guessing, as well. That could be maybe around the adnexa.
Yeah, for sure. That's a very, very great point. There's more movement towards kind of moving outside just this area to probably more of the upper half of the face within our specialty. There are a lot of oculofacial surgeons who do full facelifts. I personally don't. But to your point, a lot of times when we talk about droopy eyelids, it's a result of a drooping eyebrow, and then lid laxity or sagging upper lid skin, as well as sometimes a weak muscle of the eyelid. So a lot of times it's not just the eye itself, it's the forehead. And like you said, sometimes it bleeds into the mid-face and the cheek, things like that. So I'm still learning, and eventually I do want to move kind of outside of that eyelid area as well.
So you've kind of already answered this, but what do you love the most about being an ophthalmologist?
I love sitting during surgery on my wheelie chair.
So he's rolling around.
Yeah. I would say it's definitely the variety of our day-to-day, because you can be in the clinic, you can have a couple days in surgery. The surgery, from my perspective, is very exciting. You get a good variety, and each day is never boring. So I really enjoy that aspect.
And something that's neat about your profession, you do cataract surgery, improves their vision. Patients love that, obviously. But when you do blepharoplasties, people look in the mirror. They have to look at their face every single day, so they get to see the results of what you did.
Yeah.
So it's kind of rewarding when they can look and see, oh, I look younger, or I look better.
For sure. And it's definitely a double-edged sword in a way, because a lot of times people, after their surgery, they feel really happy, they feel rejuvenated. An upper lid bleph is typically the most bang for your buck. You see a really significant difference afterwards. But then people start they see the change that a bleph can bring, and then they move on towards other things. Similar to after a cataract, they're like, oh, now my golf game is not great. After a bleph, they're like, oh, now I have these wrinkles,
Right.
And they want to keep going. And sometimes within the aesthetic field, body dysmorphia is, a topic of concern, and you want to communicate well with your patient in that sense.
And it probably, for the patient, it gets a little bit addictive. Or like you mentioned, like they have a blepharoplasty, like, oh, now I see a wrinkle here, or now maybe I want to pull this here.
For sure.
So you're kind of like the leader of that.
You have to really get a good sense of what the patient wants, and a lot of that comes through communicating with your patient during a consult, but also knowing what your limits are as a surgeon as well. If they come in and they bring a photo of themselves from like 30 years ago and they tell you, I want to look like this, you sometimes just tell them, I don't think I can achieve that for you. And
Is that what people do? They'll bring a photo of themselves younger and say, I want to...
Oh, yeah. Or they don't say that out loud, but they're like, look at my eyes. They were so, nice 30 years ago.
Right.
And I agree, yes. My eyes will be nice.
Now, you're not originally from Michigan, right?
No.
What brought you to Fraser Eye?
Life circumstances. Well, it's a long story. I essentially moved back and forth between Michigan and Boston while growing up. So I attended high school in Michigan and then went to Boston for undergrad, and then came back for medical school, and then went back to Boston for residency and fellowship training. And then my parents were still in Michigan at the time. So I decided to come back, and I found a really great practice that aligned with my vision for my career.
So what does a typical weekend for Dr. Dye look like?
Oh, well, Friday night I like to visit Costco right before it closes, because there's not a lot of people. And then Saturday I have my painting class from 10 to 1.
Oh, I love that.
Usually I try to get a workout in before. And then the rest of the day, typically my boyfriend comes over and we spend dinner together. And then Sunday, depending on how scary my surgeries on Mondays are, I either prepare for that or I do my regular meal prepping, all that stuff,
Oh, I meant to ask you, what about the pottery? Were we done with the pottery classes?
No.
Pottery and painting?
Yeah.
Where do you do pottery?
At the Oakland Community College, right down the street. I have a full arts and crafts schedule.
Is all your art hanging around your house too?
I have 2 completed pieces of painting.
Are they hanging up in your home?
They're hanging.